You will never be able to breastfeed. You'll lose the feeling in your nipples. There's a good chance you'll get an infection and you might have to have your tits taken off.
If it wasn't for the accent, I would totally assume that that man is part of the US government making decisions about women's health here in this country. But he's got some points, and let's break down which ones are true and which ones are just completely false. Now, the first thing that he claims is that you'll never be able to breastfeed if you have breast implants, and that's completely false. The reason being is that there's several ways to avoid the glands in the breast that actually produce the milk with different incisions and also different places that we can place the implants. So, for example, if we put an incision around the areola on the underside of it itself, then that does increase our risk of creating some difficulty breastfeeding because now we're cutting through some of the ducts and that will create some scar tissue and those may not come back. The other way that we avoid having problems with breastfeeding is where we actually place the implant. Studies have shown that when we place the implant above the muscle, directly underneath the glands, there's some increased risk of damaging those glands and causing some difficulties with breastfeeding later on. If we go ahead and place the implant directly underneath the muscle, well, that has the lowest chance of affecting breastfeeding, and usually about maybe 80 to 82% of patients can actually still breastfeed if their breast implants are underneath the muscle. On top of the muscle, it's about 75% of patients that can still breastfeed afterwards. Now, the second claim that he makes is that you'll have numbness to your nipples. You'll lose all sensation. And he's actually kind of right there. Because what's going to end up happening is you will have some temporary numbness to the nipples and the areolas after this procedure. But that also depends on where we place the incisions. So for example, again, if we do the incision around the areola itself, that might increase a little bit more of the risk of having some permanent numbness to the nipple because, again, we're cutting directly through those nerves in that area. But if we go ahead and place the incision down low, down here, or even up here in the underarm area, well then there's really about a 5% chance with those two incisions of really having some permanent numbness to the nipple and the areolar complex. Reason being is the nerve that gets sensation to the nipple actually comes from way out here. Now, the other thing that can affect sensitivity to the nipple is the size of the implant that you pick. See, larger implants, let's say over like 500 cc's, those are going to put a lot of pressure on the tissue, especially if it's your first breast augmentation. All that skin has to stretch. So if you're going with like really big implants the first time around, there's a chance that you might stretch on that nerve, and you might stretch on that nerve enough to where the sensation doesn't come back. But if you're wondering what size that may not really cause so much of a problem with stretching on the nipple sensation is really probably less than 500, maybe, that 400 to 250 cc range, which is more common these days because we're seeing a lot more smaller breast implants go in rather than the 600s and the 800s. And somebody even makes 1,000 cc's now. Like, that is crazy. Where's the switch done? There it is. So, and the final claim that he makes is that you're going to get an infection, and the risk of that is so small. It's about a 1 to 2% chance of getting an infection after getting a breast augmentation. So we do a lot to make sure that you don't get an infection. We do it in a sterile operating room. We also use no-touch technique, and that tends to affect other things, but we try to not touch it. We also load it into what looks like a kind of pastry funnel, and that is called a Keller funnel, and that allows us to actually place the implant into your chest without actually having to touch it, so that way we just come into no contact with this thing whatsoever, as much as possible. After that, typically we'll put you on some antibiotics to go home with, so that way we can do everything we can to make sure that you don't get an infection. But what happens if you do get an infection? Well, I guarantee you that we're not going to, you're off. You get to keep those, but the breast implant does have to come out. And eventually you're going to have to get on some antibiotics for a while as well. But that's a whole different story. So, hope you learned something. I'm going to shoot a YouTube video. Later.